Now let us see what is antidepressants. Now let us observe what is antidepressant drugs. The drugs decrease depression. Drugs which decrease depression. So what they do, they enhance alertness. That means the pleasure, whatever we were thinking, no, those will be enhanced. Alertness, paying attention, and improves behavior. These are the drugs which decrease depression by enhancing alertness and improves behavior. Potentially or directly acting on serotonin. These levels, actions will be improved. Serotonin, noradrenaline, dopamine, their levels will be compulsory, will be improved. So what they are telling you, see, antidepressants will increase these neurotransmitters where? In the synapse. So one more important thing is antidepressants takes at least 2 to 8 weeks to show action. So if you take the tablets today, you don't get the action within the next hour. For example, if you have fever, if you take paracetamol, your body temperature will come to normal within 1 hour or 2 days, depending upon the type of disease. But here it takes 2 to 8 weeks to show action. It takes long period of time to show action. Are you clear, please? So now let us see classification of drugs. Classification of drugs. There are many drugs here. So here you can see it. Typical and just like typical and atypical. Here also typical antidepressant, atypical antidepressant. Typical antidepressants will act. They increase or prevent reuptake or prevent metabolism of serotonin and noradrenaline. If they show action towards serotonin and noradrenaline, they are called as typical antipsychotics. Atypical antipsychotics means they show, apart from the noradrenaline and dopamine, they also show action on other neurotransmitters like norepinephrine, like that. Typical means what? First, what they have when they're doing the research, they thought it is serotonin and noradrenaline is the one responsible for depression. Later, they have included even dopamine. Even dopamine. Now, here they have classified typical depressant, typical anti means drugs acting on serotonin, noradrenaline. Now, whereas atypical drugs means they act on serotonin, norepinephrine. Along that, they act on dopamine, adrenaline, other neurotransmitters. That's why they are called as atypical antidepressants. Are you getting it or not, please? Phillips. Hello? Philip? He's not in the meeting, huh?
Yes.
Are you getting?
Yes.
Oh. Then Kelly? Kelly? Okay. Bernice?
Yes.
Are you getting the difference
Yes.
between typical and atypical?
Yes.
Okay. Now let us go. So many drugs are available. Lot of research has been done. So let us see now typical anti-drugs. We are learning medicinal chemistry classification. Tricyclic antidepressants. They have three structures in it. That's why we call it as tricyclic antidepressants. At the side, I have written typical like that. That means they can act on serotonin or norepinephrine. Here the examples you see: imipramine, desipramine, amitriptyline, nortriptyline, doxepin, amoxapine. Then mirtazapine is the only drug which has tetracyclic. All these drugs have three structure. Now mirtazapine is tetracyclic drug. Then you see serotonin norepinephrine reuptake inhibitors. SNRIs we call. S for serotonin norepinephrine reuptake inhibitors. Example, venlafaxine, desvenlafaxine, duloxetine. These drugs are called as serotonin drugs. Then they are also called as non-tricyclic. So these drugs are tricyclic, no? Apart from that, they don't have any tricyclic system. Then monoamine oxidase inhibitors. MAO, they block the enzyme called monoamine oxidase enzyme. So examples you see: iproniazide, phenelzine, then tranylcypromine, salicylene, rasagiline, chlorgyline. All these are called as monoamine inhibitors. In the first statement, you see what we told: they increase, prevent reuptake or prevent metabolism. These drugs, these monoamine oxidase inhibitors, are the ones which prevent metabolism of these neurotransmitters. They are called as this. Wait. This is also called as atypical. Monoamine oxidase inhibitors are also called as atypical because they can act on even adrenaline, dopamine, and all those things. So this is called as atypical monoamine oxidase inhibitors. Then selective serotonin reuptake inhibitors. These are also typical. Here they are acting only on serotonin. Example, fluoxetine, fluoxamine, sertraline, citalopram, escitalopram. These are very good drugs. Nowadays, no, the usage of fluoxetine is becoming high. These are also typical. Only atypical, which I told wrong, is example is this one. Monoamine oxidase inhibitors are atypical antidepressant drugs. Now, atypical antidepressants, apart from them, is it all these are atypical drugs. These are selective norepinephrine. Previous drugs are norepinephrine reuptake inhibitor. Here only norepinephrine. Only norepinephrine. Atomoxetine, reboxetine, venlafaxine. Then dopamine norepinephrine reuptake inhibitors. Bupropion, very good drug, methyl phenytate. Then other drugs you can see mirtazapine, which we discussed here. Mirtazapine. Mirtazapine is also atypical drug. Nefazodone, agomelatin, mainserine, opiomopol, uh, trazodone, all these are atypical antidepressants, others which doesn't have any specific action. Now, a drug for bipolar disorder is lithium carbonate. So both depression and what is that? Maniac. We can use, what is the drug used? By lithium carbonate. So this is the classification of drugs. You can see it. Again, I'm telling tricyclic antidepressant, serotonin-norepinephrine reuptake inhibitors, monoamine oxidase inhibitors, then selective serotonin reuptake inhibitors. Atypical here is norepinephrine reuptake, dopamine norepinephrine. Other, they have multiple receptor activity of these drugs. Now, let us see. First class of drugs are tricyclic antidepressants. Tricyclic antidepressant. These are called drugs. Let us go directly here. No, we learnt in previous drugs. This is our drug, antipsychotic, chlorpromazine. Chlorpromazine. Here in the SAR, our chlorpromazine, we told increasing the size of phenothiazine ring, central ring. We told that we get imipramine drug. So this is how these chlorpromazine drugs were the principle for discovery of antidepressants. So you can see it here. Tricyclic antidepressants were first generation antidepressants. They were accidentally discovered while searching for better chlorpromazine derivatives. Chlorpromazine derivative. Hence, they have similar structure. That's what we are writing. We have written. So, chlorpromazine is the one which have given us antidepressant drugs. What they done? They replace sulfur and increase the size. Here you see, they increase the size here. Increase the size. So when they increase the size, then we got this drug imipramine. Okay? Imipramine. This is imipramine. Amine. Imipramine. Now, amitriptyline. You can see it here. This nitrogen has been replaced. Here, this nitrogen has been replaced even with carbon. Then it is called as amitriptyline. Amitriptyline. You can see for imipramine, the name of the drug structures, you see, dihydro. Here, extra hydrogen, here, extra hydrogen. Two hydrogens are extra, here and here. So that's why dihydro, dibench, this is the benzene. Two benzene. How many benzenes are there? Two benzene. Epene, 7-membered ring structure. Epene ring structure. Now, in case of amitriptyline, it is, you see, dibenzocycloheptene. Here, azapine ring, epene ring was present. Here, there is no epene ring. There is no epene ring. It is cycloheptadiene. See? Diene. So double bond is outside the ring. Hexocyclic. This is called as hexocyclic. Hexocyclic. Now, here you can see it. One of the, just like amitriptyline, one of the carbon has been replaced with oxygen. Oxygen. Here, you can observe here oxygen. Now it is dibenzoxapine. Here, azapine. Here we have told azapine, nitrogen is present. Here oxygen is present. Example of drug which have this structure is called as doxapine. Now, there are few drugs with double bonds at this ring. Then it is called as protriptyline. Protriptyline. What's the chemical structure? You see, all the chemical structure name I have written and highlighted by yellow. What is this? Dibenzo. You see a dibenzo. Cycloheptadienyl. Here what happened? Cycloheptadienyl. Let me clear. Here you see dibenzo cycloheptadienyl. Why? Because here if there is ring, it is all the ring. If there is a double bond here, it is also applicable to this ring. So there are two double bonds in this ring. That's why we written diene. Now here it is three rings, three double bonds. 1, 2, 3. So this is called as dibenzocycloheptadienyl. So these are the various drugs which we got from cyclopropane. Cyclopropane was the instrumental drug for... Yes, please. Okay. Instrumental drug for identification of these tricyclic antidepressants. In this diagram, in this slide, please observe the numbering system. Numbering. So here, the numbering we have started from the A ring. A ring we have started numbering. From A ring, first unfused. I have already discussed all these. We have started numbering from this end such that nitrogen gets lowest number. So this is how we need to give numbering. 1, 2, 3, 4, 5. Clear? If you start from here, 1, 2, 3, this nitrogen will get highest number, will get highest number. That's why we need to start from here. You can also start from here. There is no issue. If you start from here also, same again. 2, 3, 4, 5. Please remember, I told you what is bicyclic system, what is fused carbon, what is unfused carbon. So we need to start from first unfused carbon. So these are the things. Clear? So these are the drugs which we were telling. Imipramine. I showed you the structure. Imipramine, what happens? There is nitrogen in it. Imipramine. I will tell what is the structure of decipramine and all those things. So now coming to SAR. This is the, in the SAR you can see it. I brought again the structure same. Now while learning SAR, you can observe the structure simultaneously given here. Given here. Now you can see it. See, tricyclic antidepressant are obtained by replacing sulfur by CH2CH2 in the phenothiazine. Phenothiazines we studied, no? Antipsychotics. So that's what we are telling. The sulfur has been replaced by CH2CH2 group here. So it consists of 7-membered B ring, which is attached by 2 benzene rings. Benzene ring. Now there can be a double bond between 10 and 11. 10 and 11 bridge can be ethylene or vinyl. We can also double bond compound. We can call it also vinyl. Then the drug name is protriptyline. You can see it in previous slide. This is protriptyline. You see a double bond is present at what's that, 10 and 11. This is the protriptyline which we are discussing. With no change, even the presence of double bond doesn't affect any activity. Now, there won't be any substitution mostly. Now, you see, the alkyl side chain, the side chain at nitrogen 5. So, generally, students, you get confused with the phenothiazine. These are tricyclic antidepressants which are obtained from phenothiazines. From the phenothiazines. So, now here the side chain, you see here, alkyl side chain length at N5 should be minimum of 3 carbons. Same way as like that. Same way as that. Now, minimum should be 3. Now, you can see it branching. We are discussing about branching here. Well, branching the propyl side chain. This is the propyl side chain. 1, 2, 3. So 1, 2, 3. This is the propyl. Branching the side chain with 2 methyl group, we got a drug called as imipramine. Trimipramine. What happened when you branch it? What happened? There is decreased activity. See, 100 times the activity is reduced less than the imipramine. For both serotonin reuptake transporter, this is a serotonin reuptake. T means transporter. Norepinephrine, T means transporter. So if there is branching here, there is decreased activity. There is decreased activity. Now, so we in this what we told, numbering should be in this diagram. In the previous whatever we studied, we are seeing, you see, numbering should start here. So 3, 4, 5. Then go to next ring, 7, 8, 9, 10, 11. This is the way of numbering. What we told, there can be a double bond here. There is no change in activity. Then we told about this side chain, that is propyl side chain attached at nitrogen 5. What we told, propyl is best. 3 carbon atom is best. Branching, decreased activity. Now, let us discuss about this nitrogen. Here, this nitrogen is tertiary nitrogen. Tertiary nitrogen. So, this drug, you see here, this is called as imipramine. Imi means what? Nitrogen is present in the ring. Now, imipramine in the body get metabolized by dealkylation. Dealkylation, removal of one alkyl group. We get a compound called as DES. Nothing but removal of one methyl group. Then it is called decipramine, which is more potent. Nowadays, actually decipramine is a metabolite. Nowadays, decipramine is available as a drug itself. Is a drug itself. So this drug, decipramine, deci means loss of methyl group, one methyl group. Remaining structure same to same, you see, bicyclo group, epene ring, propyl side chain, but here one methyl group is lost. So this is decipramine. This is imipramine. Now, let me clear. Now, here you can observe that. So decipramine is less potent. There are many side effects with imipramine. Decipramine is more potent. And also you can see faster absorption can be observed. Bioavailability is good. And activity is more towards norepinephrine, norepinephrine and serotonin. Whereas this imipramine can also act at muscarinic receptor. It can also act at alpha-1 receptor. It can also act at H1 receptor. This drug, it is acting more on another receptors. Whereas this is more towards 5-HT and norepinephrine. So that's why lack of methyl group on the side chain increases activity. Among these two drugs, which is more active? This is decipramine is more active. That's what we are telling. Monomethylines on the side chain is more potent than dimethylamine as shown for decipramine. One more drug, nortriptyline. We can see next slide. So next, this is the next drug. So here you can observe, please. Here you see amitriptyline. In this 7-membered ring, we have converted to cycloheptane ring. There is no nitrogen here. If there is nitrogen, it is called as imipramine. If there is no nitrogen, it is called as amitriptyline. This is amitriptyline. Now, here also you see amitriptyline is less potent because you can see it here. Tertiary nitrogen. Now, here you see secondary amine having one methyl group. Now, this drug is called as nortriptyline. We learned nor. Nor means lack of one methyl group or less methyl group. Adrenaline, noradrenaline. One example. Adrenaline will be having two methyl group on nitrogen. Noradrenaline will be having only one. No, adrenaline will be having one methyl group. Noradrenaline will not have any methyl group. So the difference between adrenaline and noradrenaline is less one methyl group. In the same way here, nortriptyline is more active. The same reason, more bioavailability, they are acting on only one receptor like that. Clear? Just like phenothiazines, presence of an electron withdrawing group at second position produced one drug called as clomipramine. So you can see here, again I drawn the structure imipramine. This is the structure of imipramine. There is no any chlorine atom here. If there is chlorine atom, it is called as clomipramine, which is, see, most powerful antidepressant ever made till now. This chlorine atom. Some analogs they have tried with cyno group, that is there, but it didn't come into the market. Clomipramine is the drug which came into the market. Clear, please? Any doubt? Now, after this slide, you can see it. So this is the drugs, you see, all the drugs which have tertiary amines in it. You can see it at the dose 100 to 300 milligram per day. Whereas amitriptyline, its mono is not triptyline. You can see the dose is 50 to 200. Anticholinergic effect, you see, 4 plus. That means more potent. Here you see, plus, 4 plus means very high. Now you see nortriptyline has 2 plus. That means moderate. High, that's all. It is here very high. Amitriptyline sedation activity, you can see more. Whereas nortriptyline, the sedation activity less compared to that. Orthostatic hypotension, because these drugs are acting at alpha receptor, so there is decrease in BP. You can see orthostatic hypotension is more with amitriptyline, whereas these drugs, you see, very less. Heart effects, you can see it. Weight gain also you can observe. Tertiary amines are causing more side effects, all those things. Whereas secondary amine are causing less. So what are those secondary amines, drugs with secondary amines? You see, for example, amitriptyline. Amitriptyline. Here you see, nortriptyline. Then imipramine, this, decipramine. These drugs are more active. More active, more trapped. Even see protriptyline. You see protriptyline. What is the structure present here? What is the nitrogen present here? Protriptyline. See, only one methyl group. See, other drugs you can see. Mepotylene also has one methyl group. Remaining drugs, you see, there are 2 methyl groups attached. Imipramine, amitriptyline, doxepin. So, Aksar Patel. Mr. Aksar. Okay. Alir. I'll give absent if you don't respond.
Hello.
Yes, Alur.
Yeah. What was the question?
How did we get these tricyclic antidepressants?
How did we
get these tricyclic antidepressant? From where, from which drug did we get?
We get them from we actually get them from phenelzine.
Phenelzine. So what? Very good. What was the structural modification that resulted tricyclic antidepressants?
I didn't get that question again. Please come again.
What was the structural difference or structural modification is done on phenothiazine to convert into tricyclic antidepressant? Who can tell?
I think it's the structural modification is let me say the replacement of sulfur atom in the central ring of phenothiazine with the carbon atom.
Good. Okay.
Yeah.
Next, Khalid.
Yes.
What is the main reason for depression?
I think it is due to maybe the decreased levels of serotonin. It is usually maybe okay. It is low self-esteem.
No, the self-esteem is the symptom. What's the reason?
The main reason of depression is usually mainly due to the decreased levels of serotonin.
Serotonin and one more.
Yes. And maybe is it noradrenaline and dopamine?
Okay, noradrenaline. Okay,
Yes.
good. Now, Chisom,
Yes. Yes.
can you give few examples of drugs which have tertiary amine?
Amitriptyline and imipramine.
Imipramine.
Pronouncing it.
Okay,
Yes.
very good. People are listening. Jeffrey, please unmute yourself. Okay. Isabel,
Yes.
can you give few examples of secondary amine? Drugs having secondary amine here?
There's nortriptyline and decipramine.
Cytochrome. Good. Lillian,
Yes.
among these two type of drugs, which is good? The
Pardon?
drugs containing secondary amine, drugs containing tertiary amine. Which drugs are good? And give reason.
Secondary, because they are more potent and they have faster absorption and bioavailability.
Okay. Good. Let us go now. So this is what we studied. So this is the only drug which have, you can see many drug. There is no substitution on the ring. Only drug which has substitution is clomipramine. Clomipramine. Now this slide, you can see it. These are the explanation. You see, tertiary amine has, they need high dose. They have anticholinergic high, sedation high, orthostatic hypotension high, cardiac effect high, weight gain is also high. All these tertiary amines, you see, amitriptyline, imipramine, doxapine, trimipramine, all these have high. Secondary amine, three drugs you see, nortriptyline, decipramine, protriptyline. They also have, but less. And the dose also is compared to this, you can see it. Amitriptyline is parent drug. Its metabolite is not triptyline. You see, 50 to 200. It's almost 100 to 300. Then imipramine is the 100 to 300. Here also 100 to 300. But activities is decipramine. You see, depression, sedation, you see, very less. Here, 3. Here, 2. What does 3 means? Very high. 2 means high. 1 plus means moderate. Moderate. Weight gain in decipramine, you see. All these drugs are very good in weight management. Whereas here, double, 4, very, very high. Weight gain is expected when you take these drugs. Then finally, the mechanism of action. Now, these drugs, you see, this is the way, how does these drugs act, you see? So this is presynaptic now. This is postsynaptic now. So when you receive a signal, what happens? Neurotransmitters which are stored in presynaptic nerve are released here. Released. So these neurotransmitters should bind to the receptor present in the postsynaptic nerve. But what happens is that by somehow unknown reason, what happened? The neurotransmitters what released are taken back. Are taken back to the presynaptic nerve. This is the mechanism of action. Now, our drugs, what they do is that they block this process. They block this process. So, when they block this reuptake mechanism, the availability of neurotransmitters in the synapse is high, increased. So, what happens is that you don't feel that depression, you will respond to the changes. You feel, you talk more, so it will happen. So these drugs, see, inhibit reuptake of neurotransmitters. That's what we are telling. So normal mechanism, normal function what? I'm telling normal function once again, you see. On receiving the signal, the neurotransmitters which are present here are released into the synapse. By some other reason, what happens is that these neurotransmitters are taken back. So the availability of neurotransmitters in the synapse will be less. Now our drugs, what they do is that they block, sorry, let me take different color. They block this process. When they block this process, what happened? The neurotransmitter availability in the synapse, which was less, will become more. So signals will be passed very well. Will be passing more. So that's what we told. We told in the first slide itself, second, third slide, minimum 3 to 6 weeks we told. Here you see these drugs takes 4 weeks to show antidepressant activity. Tricyclic antidepressant have no longer effect on dopamine. They block Serotonin-Norepinephrine, not on the dopamine. So this is the mechanism of action. So what are the side effects? Sedation, orthostatic hypertension, cardiac arrhythmias, weight gain. These are the side effects. Still, I don't need to tell again and again these things. So metabolism. So this is what we were telling. Metabolism, you see, imipramine. Here you can see this is a 2-methyl group. Now, because of dealkylation, see what happened? Hydrogen, we are getting decipramine. Then one more way of metabolism is that hydroxylation at this position, at this 11th position. Even hydroxylation at the aromatic ring. So these are the 2 hydroxylation. N-oxidation, like this, or even this. N-oxidation can occur. These are the metabolic places where the drug imipramine can undergo metabolism. Clear? And one more you see, There is also dealkylation here. Even here, it can undergo dealkylation. It also can undergo dealkylation. When there is hydroxyl group at 11 and second position, what happens is that glucuronization can occur and go out from the body. This is the metabolism of imipramine. So you can see it. These drugs uses, you see, severe major depression. It is used to treat depression. It is also used to treat phobia, maniac disorders, panic disorder, sorry, and neuropathic pain. In the pain, you can see it here in post-herpetic neuralgia. After HEPS infection, you will be having nerve issues. HEPS infection means chickenpox or something like that. So you will be having pain on the body. Nerves will be very paining. In that condition, we can use this drug along with the NSAIDs. So that's what we are telling. See, first line treatment for post-hepatic neuralgia, including tricyclic antidepressant. We can use gabapentin. We have seen gabapentin in anti-epileptic drugs. Pregabalin, the same. There also we studied post-hepatic neuralgia. Usually this, for the treatment of this, the drug is given in the form of patches. And also we can use topical 5% lidocaine patch. That is local anesthetic. Lidocaine is local anesthetic. In all these can be used to treat this post-hepatic neuralgia. Then it's also used in obsessive compulsive disorder. Now, one more use of these drugs, you see, it's very good use in treatment of nocturnal eurisis. Some children, even after 10 years, above 8 years onwards, they still wet the bed. They go urine in the bed. And in that condition, it is used. And what they do is that by causing contraction of sphincters of the bladder, here they cause contraction. They cause contraction here. So when the opening is, say for example, if this is a bladder, when the opening is tightly folded, what happens is that no urine will come out. This is an side effect: depression, drowsiness, sedation, dry mouth. Dry mouth is because of anticholinergic effect. Acetylcholine, no. There is no acetylcholine activity, so it's a dryness of mouth. Constipation, same. Blurred vision, same. Urinary retention. Here what we are telling, to treat nocturnal eurisis. Those who are going for urination in the bed, it is used. But the side effect is urinary retention. Weight gain, we have seen. Some of the drugs have metallic taste. Then we have, see, cardiac arrhythmia, orthostatic hypotension. All this is explained here in this slide. So this is about these drugs. Then last one, synthesis about tricyclic antidepressants. This is the last slide. You can see it here. Here we are taking just like phenothiazines. We are taking this drug or this chemical, dibenzoazepine. Dibenzoazepine structure is taken, and dimethyl aminopropyl chloride, same like phenothiazine. And we are using, what is this group? Soda amide, which is a base. So it abstracts the base as H plus, and this H plus will react with chlorine Cl minus and goes out as HCl, and this ring, this carbon will attach to the nitrogen to form this. What is this drug name? Imipramine. How can you remember imipramine? Nitrogen is present and tertiary nitrogen. If there is no methyl group, it is called decipramine. If the nitrogen has been replaced by carbon, amitriptyline. If there is no methyl group here, it is nortriptyline. Any doubt, please?